Okay, so Unit 9, Relationships and Communication. We were born into relationships. All infants have caretakers, and as children and adolescents, we have relationships with adults and peers. Adult relationships can take on many dimensions by providing us support, addressing many personal needs for ourselves and others, and using available resources. It is said that no one is an island, and we cannot exist alone. We must exist in relation to others, even if only indirectly. So many therapists who specialize in couples and sex therapy tend to take what is called a system approach to their clients. Keyword, systems approach. So characters of healthy relationships. Some people believe that we experience life most directly and perhaps spiritually through our interactions with other people. A great deal of how we experience life is connected to the relationship we have in our own life. So having good friendships and positive relationships with those considered to be family is beneficial for many reasons. So social support and a network of intimates help us live longer and happier. So being able to be ourselves with others is a key reward of friendship. So being connected to people in positive ways create what is called a social capital. Just the status of being in relationships with family members, partners, friends, coworkers, neighbors makes us feel generally happier and healthier. This is a lucky thing since we're literally born into relationships. Experiencing your family as a source of support and love is a positive attribute that can have an extreme impact on one's life. So parents, siblings, and extended family members can provide security emotionally, physically, and financially. For many, their family provides a sense of heritage, tradition, and kinship, which can be very positive. Those who lack feelings of connection to their biological family for whatever reason can often create a family for themselves composed of friends or coworkers who are important to them. These groupings address the important needs of security, belonging, love, and connection that families provide. This reminds me of the zealous zebras. It reminds me of that family. You might be missing a component within something else, but it's here. Our ability to form and sustain important relationship is a critical aspect of our overall health and well-being. And unfortunately, few people receive any explicit instruction about how to navigate relationships well. We are left to learn by observing and doing. Observing others can be a confusing way to learn about relationships. We only know what we have the opportunity to observe, which is filtered through our perspective. So unless we have the opportunity to learn directly from those involved in the relationship about the backstory and how it's really working for them, we are left with only our impression of how well it represents a successful relationship which works for everyone. So I'm sure that we can relate to this in so many ways, whether it's watching another family member, maybe even watching our parents, and you're not knowing exactly the whole story, or sometimes we might think we know the whole story. But your perspective, this whole point is there's like no formal training on how to really read relationships. We just kind of learn it as we go along. We start off as children doing it, and here we are as adults. No formal training on this. Just a minute, it's not going to the next page for some reason. Just a moment. Okay. All right. Meeting needs in relationships. So throughout our lives, we all have needs that are addressed through our important relationships. So examples of these needs are identified in David Rico's book, How to Be an Adult in Relationships. And it includes attention. What is attention? To have engaged focus on you that is respectful and sensitive to your needs. This creates an ever-increasing space of trust and safety. Acceptance, an unconditional validation of your choices and lifestyle, to be embraced as worthy, trusted, understood, and truly approved of in your uniqueness. Appreciation, expression of acknowledgement and gratitude, foster feelings of closeness, an aim for a ratio of 5 appreciations for each complaint you voice in your relationship. Affection, to be loved unconditionally all of the time and liked most of the time. Love is uniquely experienced by each person and is both physical and emotional. Allowing. Allowing is heartfelt permission to be yourself. This allows the expressions of one's deepest needs and wishes and encourages passion and aliveness. I think that's a nice book, How to Be an Adult in Relationships. So our earliest childhood relationships with our parents or our caretakers provides our first experience with having these needs addressed. Opportunities for needs to be met include our whole life. It is never too late in life to address any of these needs, and they continue to be present during our lifetime. So emotional intimacy and shared feelings of love enrich our lives. A great deal of research has been conducted on this, but the pioneering research in the developing of the theory of emotional intimacy and love was Robert Sternberg in 1986, where he came up with what was coined the triangular theory of love. This is key, it's on the quiz. This theory describes the relationships as being made up of in varying degrees for different people. The following 3 components are passion. Passion refers to the drives that lead to romantic feelings, the physical attraction, and sexual interactions. Passion can be a benefit to self-esteem and provide a feeling of affiliation with another and self-actualization. Intimacy. Intimacy is the second component. It refers to the feelings of being close and connected to another or other in loving ways. Intimacy in a close relationship is characterized by shared high regard, understanding, and emotional support. Commitment. Commitment refers to deciding to have and maintain love for another or others. Commitment can be short or long term. So those 3 things, passion, intimacy, and commitment, are part of the triangular theory of love. I have no idea what this keeps doing. It keeps opening up another tab in order to go to the next one. All right, what makes a relationship work? By analyzing successful, healthy relationships, we can learn about what makes love relationships work. Researcher John Gottman has identified 7 principles that can revive and strengthen those relationships. And here they are. 1, enhance your love maps. Make a point to know about your partner's life. Storing and updating information about important events, ideas, and feelings in regards to your partner creates the love map. So a term first coined by researcher John Money. The data can be as simple as how your partner likes their coffee, or knowing which shows to record on TV for them, or how the day has gone just by a look. Only by knowing someone we really love someone can really love them. The next component, nurture. Your fondness and admiration, feelings of honor and respect are crucial elements of a long-lasting romance and love. Think and talk about positive feelings for your partner each day. Try to identify at least one thing that you are grateful to your partner for. Turn towards each other instead of away. Try to stay connected with your partner by letting him or her know that they are valued in small ways. Use mundane ways. Yes, it's recording, Jasmine. Yep. Use mundane ways to connect each day. If you check out the relationship and stop putting the work in, try to get back on track and stay committed to your growth together. Let your partner influence you. Try to include your partner in your decision making. Traditional gender roles discourage men from being open to influence from men. Patriarchal or traditional leadership styles that value male decision making can make this especially challenging for some men. Solve your solvable problems. Address conflict effectively using these steps. Raise issues gently, de-escalate tension to diffuse arguments, calm yourself and each other, compromise, tolerate each other's faults, overcome gridlock. That means if problems can't be solved or are ongoing, and some are, keep in dialogue about them. Accept the differences that exist between you so they're not a source of pain. Create shared meaning. Build a culture in your relationship that honors the other's dream, even if you don't share the dream. These principles have often been very effective at helping couples cope with problems in their relationships. However, their core friendship is more important to their relationship success overall. According to this viewpoint, this friendship is the aspect of their relationship that exists for the couple when they are not fighting and what really matters. It is essential that they like and respect each other. Now, over here on the side, you have the 10 components of love. This is great. You might want to put it in a chart or do something, but I think it's something to keep. We won't go over all of those, but we will continue to read the text because these are key points and they will be on the quiz. So jealousy. Jealousy in a relationship can serve as a helpful marker of boundaries. Wow, did you know that? By experiencing feelings of jealousy and sharing those feelings with your partner, both can achieve greater awareness, understanding, and agreement about where lines are drawn. Demonstrations of jealousy can bolster self-esteem and affirm feelings of desirability in relationship. Sometimes, if a partner becomes jealous, the jealousy is taken as a sign of love. But other research has found that jealousy be more accurately indicating insecurity or immaturity than love. So jealousy can also be based on an unfounded insecurity and can potentially be an indication of an abusive relationship. So feeling jealous is natural. However, jealous feelings are expressed though anger, threats, or disrespect. This could be an indication of potential danger. It is important to remember that jealousy does not prove the existence of love, and it can be painful and can either destroy or cement a relationship. What a thin line between the two. So communication about the threshold of healthy jealousy in a relationship can be crucial in maintaining a healthy relationship. However, if jealousy is well-founded, the relationship may need to be modified or ended, and jealousy can act as a catalyst for that change. So extra relational affairs and relationships can be among the greatest threats to an exclusive relationship or marriage. And some researchers suggest that just over 20% of women and 30% of men report being sexually unfaithful to a romantic partner at least once. Now, earlier studies by researchers such as Widerman reportedly found that men engaged in infidelity more than women. However, more recent research seems to suggest that the gender gap is narrowing, and when transgressions other than intercourse are taken into account, women report as many acts of infidelity as men. While the majority of married people do not have sex outside of marriage, research is fairly consistent in finding that about 20 to 40% of women and men do. People can address lots of unmet needs in addition to sex through an affair, including needs for affection, recognition, and self-worth, as well as to banish loneliness. Wait, what section was that? What makes a relationship work? No. Yeah, so let's go to 4. Relationships and communication. Communication is inherent in all interactions all of the time, and we cannot communicate when we are with another person. Even a blank stare and silence communicates something. We are constantly sharing verbal and nonverbal cues that actually create meaning for others. So these cues include facial expressions, movement, gesture, touch, tone of voice, word of choice, metaphors, and silence. So it's helpful to examine these channels of communication in order to understand how we use each of them and to better understand how those around us use them. So our role and status in a relationship may also impact our communication. We communicate differently with our parents, siblings, and children than we do with our significant others. And we talk about different topics too. So sometimes people in close or long-term relationships, even as coworkers, friends, or colleagues, can develop a shared language and inside jokes that further strengthen a relationship. Regardless of the strength of the communication, it is a transactional process that involves conveying symbols, words, gestures, or movements. And there are 3 primary contexts of communication. There's cultural, social, and psychological. The cultural context is the language, values, and beliefs and customs in which communication takes place. The social context is the roles that we play in society and how that may impact our communication with people. And the psychological context is how people may communicate with each other differently based on their personalities. All right, so we have here another chart, and it talks about listening skills. If communication is a key relationship skill, and it is, listening is a key communication skill. Good listening involves focus on being interested or not being interested. Start by asking questions. Ask people questions about their goals and visions for the future. Look for commonalities. Tune in with all of your attention, respond with occasional and brief nod or sound, and from time to time, paraphrase what the other speaker says. Maintain comfortable eye contact, let go of your agenda, avoid distractions, turn off the TV or put your cell phone down, right? So as we've discussed, talking about sex can be difficult at times. So even if we have experience talking about sexuality in group educational settings, this is different than communicating with a partner or potential partner sexually. Communicating about our own sexuality involves emotional vulnerability on a different level. One way intimate partner communication is different is that it is mutual and shared vulnerability between people. Whereas leading a group position, the facilitator's role as having different vulnerability than the students have. A personal sexual interaction is about you and your interactions. This is not the same as your role facilitating a group. In the group, the professional self is used as a tool that is focused in the group's experience. This focus on the student is also the case in one-on-one professional interactions with individuals. It becomes clearer than an ability to conduct an educational discussion about sexuality. doesn't necessarily transfer to communicating with the intimate partner sexually. So communicating about sex. So this vulnerability and trust contribute to the feelings of intimacy and connection that can enhance our ability to express and share our sexuality in both casual and more long-term relationships. However, there are ways to improve communication, especially sexual communication. So tips for sexual communication include know what you want, whether it is what you prefer in a relationship or partners, or your favorite ways to get an orgasm. Know this for and about yourself. What are your expectations? What are your needs? What are your preferences? What generally and specifically? 2, tell your partner what you want. Most times it will work well to discuss things about your sexual interactions in general ways when you're not having sex. Raise it during a walk or over coffee. Sandwich changes you'd enjoy or complaints you have. Like it means being positive between comments like this. Oh, I really like when you kiss my neck. Or I always enjoy for you to spend lots of time kissing me before focusing on my genitals. And oh, sweetie, when you hold me really tight, it feels so good. So if you aren't sure, you check it out. In moments of arousal, it can be easy to misread sexual communication. Since what we want and how we want it is different at different times. Don't assume what worked once will always work. If you aren't sure what you are doing is being received as you hope, ask. If you want to initiate something new, ask if it's okay to try. So be open. Okay. Be open, just as you hope not to be judged or opposed when you have ideas about ways to interact sexually. No doubt your partner feels similarly if he or she suggests something that you're not open for. Try to respond with something more open than no. Try to be open for exploring alternatives. Perhaps there's a version of the original suggestion that can address the desire shared and be more to your liking, or see if there is a mutually agreeable compromise that you can both enjoy. Another component is being honest. Sometimes we can communicate things because it makes someone feel good to hear or think or feel it. This can be an effective way to move things along, as in faking an orgasm in order to end a lengthy or uninspiring sexual interaction. Excuse me. Or it can boost a partner's ego or self-esteem. So the problem is your partner may begin to learn that that is how to please you. And since they enjoy pleasing you, you get more of what doesn't work. Don't make anyone feel bad about themselves, but simply say, not everything you try will work. So speak up. I think that's really key. So in all relationships, there's conflict. Conflict is a natural and intimate relationship. A lack of arguing can signal trouble in a relationship. And it isn't the conflict itself that is dangerous. It is the way that conflict is handled that may hurt a relationship. There are 2 kinds of conflict in a relationship: solvable and unsolvable problems. So solvable problems range from everyday annoyances to having differences on major issues. Just because a problem is solvable does not mean it gets solved. The problem-solving steps above offer some instances for those perpetuating differences between you that will not be fixed. Agree to disagree, honoring and respecting your partner as you disagree. So sometimes we won't agree, or you'll need to decline or refuse something that's communicated. So saying no can be delivered effectively when you remember to. So I appreciate the invitation and say, thanks for asking me. Decline clearly and explicitly, I don't want to. Offer an alternative if possible. But how about we? So those are good suggestions on that. So how we communicate about sexuality in our work as as a sexuality educator provides the basis of our integrity. We can create feelings of confidence by demonstrating our knowledge, comfort, and ability to discuss sexuality when we use language in ways that includes everyone and values those who are different. Knowing the correct terms or topics related to the sexuality and allowing others to use words they know can be very helpful in facilitating discussions in groups and on one-on-one. Creating a safe space to discuss important, sensitive issues and private matters is a gift, and you can provide through honoring the individual experience and the needs and comfort to those involved. Six, relationship structures. So we're going to go over some of the structures. So single living is increasingly common among people for all or part of their adulthood, with 45% Americans aged 18 and over reporting being single as of 2019. So most adults who choose living single are happy with their status, though the degree of happiness varies greatly, of course. Adults are spending more time single for many reasons, including delaying marriage, often until after college, high rates of divorce, and increasing social support for choosing a single lifestyle. And single people have a variety of sexual interaction patterns in relationships that might include celibacy, serial monogamy, a long-term exclusive partnership, multiple concurrent partners, and a primary relationship with occasional other partners. So there's a strong encouragement in American culture to pursue and maintain a monogamous, committed relationship with another person in long-term partnership. Taking a step further, this expectation is put into the context of heteronormative bias that's prevalent in American culture. All this adds up to a push toward a man and a woman living in a marriage relationship as the preferred relationship status. Indeed, one's reported health and well-being generally are better for those who are married than those who are not. Although men who are married report being happier than do women who are married. As compared to their unmarried counterparts, people who are married, report having more frequent sex than do other couples. Can you believe that? The marriage rate for Americans is 7.5% 1,000 total. Hold on, somebody else trying to get in. So the encouragement in American culture to pursue a monogamous relationship may not always be conducive to maintaining high levels of satisfaction. Let's see. So in addition to being single or part of a couple, there are other variations and alternatives for relationships. So polyamorous refers to having many loves. There is a very interesting book on polyamory written by Easton and Litz called The Ethical Slut that claims to be a guide for anyone who dreams of having all the sex and love and friendship they want. Polyerotic refers to having many sexual partners. Either or both may be the case in extra-relational relationships. And among those who are married, there are two types of extramarital relationship. So then there's the consensually non-monogamous, which includes those who swing as a couple with other individuals or couples polyamory and polygamy. Then you have the non-consensual, non-monogamous, includes affairs and sexual interactions with others without informed consent of the other partner. And people report many reasons in addition to the sexual interactions as their motives for having an affair, including feeling appreciated and excitement of the secret relationship. So many variations exist in how people configure the important relationships in their lives. The status of some relationships may be kept mostly private, given the strong cultural preference for monogamous marriage relationships. However, there are communities that allow for this to be open and more accepting than the mainstream society. Effective decision-making. Effective decision-making involves having full information about the situation and alternatives and acting in alignment with our values and personal ethics. Now, our personal ethics are the set of rules that we use to deal with the moral dilemmas. Individual personal ethics evolve over a lifetime as one experiences and learns more and perhaps gains clarity and insight. So when we are young, especially, our ethics are largely adopted from our family and perhaps influenced by religious and spiritual beliefs. Some ethical ideas are so universal that they extend beyond individuals. This includes concepts like honesty, social justice, and promise keeping. When considering ethical issues generally, as we move from the broad conceptual level of universal agreement to more specific situations, there is often less consensus of support among people. And an example of this potential conflict between supporting the concept of social justice and not supporting the rights of all people, regardless of sexual orientation, to legally marry. So our personal code of ethics is based on our personal values. We all have attitudes about what we think is important in life and all the things that we value. So these ideas usually form on our socio-cultural upbringing, and we value people, things, experiences, and ideas. Our ideas about right and wrong create our unique set of personal values. So cultural differences can be the source of much diversity of perspective. We are all subject to influences in our attitudes and beliefs. Our cultural heritage and current peer and support network influences our values and decisions. And our peers and experience with our culture are themselves influenced by our values and decisions. So for instance, if we are raised with no explicit spiritual teachings present, we may decide as an adult to explore a spiritual community on our own. The teachings of the new faith and the new relationships we build in that community may invite a shift in some long-held values and beliefs. 8, supporting someone who is in an abusive or violent relationship. So whether we realize it or not, we probably know someone who has or is experiencing abuse in a relationship. Remembering that it is likely to be the case in our group and individual interactions is a great first step. Abuse can happen to anyone, even those who perceive as powerful, assertive, strong, and smart. Be open to hearing about the experiences others might raise with you regarding relationship violence. You want to ask questions, and if there are visible signs of violence, many people who are involved in abuse feel some shame or possible guilt about the situation and may not raise it directly. So some suggestions for tangible ways to be supportive include: tell them it's not their fault, tell them they don't deserve it, believe them and let them know that you do. See if they need medical attention and check safety issues. Don't try to make them do something they are uncomfortable with. Recognize that leaving an abusive relationship is hard and it takes time. Encourage them to build a wide support system, including friends and family, and maybe join a support group. Encourage them to take a self-defense course. Give them good information about abuse, including the number of local crisis line or national domestic abuse hotline. So here they have a list of signs of abusive and violent relationships. We won't read through them, but really, really, really key, because you just never know when this is a friend, a family, a client, or someone, but these are the common signs. And then there's things that you can do to not turn a blind eye, I would say. So to be helpful. Let's see. Okay, so ending a relationship. So this is the last section of Unit 9. All relationships end. Some end through separation or breakup, some with divorce, and others with death. Grief is felt at this time as a result of no longer getting our needs met. It is likely that the grief was present during the relationship, but if needs were not being addressed then, they were not being addressed then, but it often goes unnoticed or unrecognized. So feelings at this time may also involve letting go of hope for potential you had envisioned, or feeling as though what you thought was there was not. So being in the midst of grief feelings can cause stress, and some suggestions for dealing with hurtful breakup include commit to mourn and learn from the experience. They want you to take all the time you need and do not let a new relationship distract you at the time. Use a hospice approach to ending the relationship. Make a commitment to compassion over ego competition. Do this by making it more important to be kind than to be right. 3, get through this without the use of potentially harmful or distracting substances. Drugs, alcohol facilitate the avoidance of grief. Remember that anyone can love and be lovable, and not everyone will love you in the way that you want to. The next one, delay major decisions for 30 days if possible. Stress affects clear thinking. Only have contact when you no longer feel you need it. Wait until it is neutral and the charge is gone for you. So those are good resources for ending a relationship in a healthy way. I like that one. It was like, don't make any important decisions for 30 days. So ending a relationship can be very difficult, but sometimes it's the best thing to do. So if a relationship is not healthy or enjoyable for everyone involved, then it may have to end. Sadly, that very often means someone will be hurt in the process. So sometimes it is inappropriate and necessary to put one's needs first. In these cases, it usually is better for everyone that the relationship ends. If you are initiating the ending, be honest, be direct, and unwavering in your delivery of your message. It is not an act of kindness to falsely lead someone on. If you are being dumped, or you're not the initiator of the breakup, do not falsely romanticize the relationship or partner. It can be easy to be focused on the loving and the romantic gazes and exchanges. Instead, purposefully envision the glares of anger or looks of indifference that were also present. Don't focus only on the good stuff you're losing. Remember the reason it didn't work. So breakups can be really difficult, and especially if you're one on the other side where they say you're not the initiator. So those feelings can be harmful if they're not processed well. So I thought these were really, really good tips that can be shared for ourselves and for others. So as sexual health promotion professionals, you will know and no doubt encounter many women and men in various stages of relationship: joy, pain, sadness, excitement, attraction, happiness, contentment, and transition. You have the potential to point people in the direction of books that may be helpful to them, relationships or marriage counselors, such as through the American Association of Marriage and Family Therapists, or to suggest that they give themselves time, space, care, and kindness when they are in a time of need. As someone who people will turn to with their very intimate and personal questions, you will be called upon time and time again to maintain their confidentiality and to provide support, reassurance, and resources for counseling or therapy. Woo, woo, woo. So there were some other book references here: Pure Romance Between the Sheets and The Ethical Slut. We referenced that. So if you are getting through your unit, I did discover that doing the interactive activity is essential. The activities are not really hard. Like, you're not going to get stuck doing this. It's not hours of homework or anything. So I'm going to show you activity 1 that I did. It's teaching healthy relationships. And so they want to know what resources exist in your community for teaching young people or older adults about healthy relationships. So I went in and looked up some resources for my area, and they just want you to list 3. So I live in Cleveland, Ohio. So I looked it up, and there's the Ohio Centers for Relationships and Sexual Health. They have African American Therapists of Cuyahoga County, and it's for youth and adults, etc. And then there was Castle's Care, and this was a resource center that focused on healthy relationships. So I just put those 3 references there. The next activity, I believe, asked you to do something similar: support people in domestic violence situations. So they wanted to know 3 resources in your area. Or it says, please list any organizations, names, and contact information. So I just put the title, the name of the organization, and the website. So that's not hard. And I don't think it's grading it like right or wrong. They just need some answers in there, right? So you want to make sure you click Save My Answer, and then go to the quiz. And we can do that now. Are you all ready for the quiz?
Yes.
Yay! All right. And thank you all for hanging in there. I really hope we have a good turnout for those who complete this. We can do it. We can do it. Okay, so jealousy, number 1. Jealousy can help bolster self-esteem in a relationship and help define boundaries. That was a yes, surprisingly, right? They were like, jealousy can let you know where you are in a relationship, right? So we're going to say true. True or false, we're going to say true. Let's go to 2. Most people have received formal education on how to act when in a relationship. Is that true or false?
That's it.
Right. We're trying to figure it out as we go along, right, ladies? From the time we come out the womb, we're trying to figure it out. Okay. I would agree with that. So 3, jealousy proves the existence of love. Is that true or false?
False.
False. Yes, it is not the indicator for love. It can help you find out some other things, but we got to also make sure it's balanced, right? So we got false for 3. 4, men and women are increasingly engaging in infidelity at similar rates. Is that true or false? Now, it gave a lot of information, but is that true or false?
True.
It's true. True. Okay, 5. Which of the above statements accurately describes the concept of acceptance? So we went over those definitions. Acceptance. Is it a heartfelt permission to be yourself? Is it to have engaged focus on you? Is it to be loved unconditionally all the time and like most of the time? Is it unconditional validation of your choices and lifestyle? Which one do y'all think? Which one is acceptance?
I think the first one.
Okay, heartfelt permission to be yourself. This allows the expression of one's deepest needs and wishes and encourages passion and aliveness. It is close, but It will be the last one where there's an unconditional validation of your choices and lifestyle. So I could see how the heartfelt permission to be yourself could be similar. However, based on the unit's definition of acceptance, it's going to be the last one. An unconditional validation of your choices and lifestyle to be embraced as worthy, trusted, understood, and truly approved of in your uniqueness. Okay, 6. Which of the above statements accurately describes the concepts of allowing? What is allowing? Is it heartfelt permission to be yourself? Is it to have an engaged focus on you? Is it to be loved unconditionally all of the time? Or an unconditional validation of your choices and lifestyle? Which one is allowing?
The first one.
Yes. So this is the heartfelt permission to be yourself. This allows the expression of one's deepest needs and wishes and encourages passion and aliveness. 7. Which of the above statements accurately describes the concept of affection? So heartfelt permission to be yourself, we already defined that one, right? Is it to have an engaged focus on you that is respectful and sensitive to your needs? This creates an ever-increasing space of trust and safety. Or is it to be loved unconditionally all of the time? And like most of the time, love is uniquely experienced by each person and is both physical and emotional. And we had already defined the unconditional validation. So it's the middle two.
The second one.
Yeah. Be loved unconditionally all the time and like most of the time.
So affection is actually to have engaged focus on you.
Okay.
It's respectful and sensitive to your needs. This creates an ever-increasing space of trust and safety. So what is meant by John Gottman's principle, let your partner influence you? Did you all know what it meant by that? Is it one should always concede what the other partner desires, or if they want to sustain a relationship, or people should try to stay connected with their partner by letting him or her know that they are valued in small ways? Or is it always think and talk about positive feelings for your partner? Or is it trying to include your partner in your decision making?
The last one.
Yeah, I think the last one.
Yeah, I believe so too. Try to.
Hey, excuse me, I have to take your temperature before y'all come in. How y'all doing?
I like somebody's working. I love it.
Have y'all been here before this bar? I need you to fill out.
That's Hattie. Awesome. She working and she working. I love it. So blank range from everyday annoyances to having major differences on major issues, whereas blank are perpetual differences between partners that will not be fixed. Is it conflicts and fights, solvable problems, unsolvable problems, disagreements or arguments, or none of the above? Which one is it? Range from everyday annoyances to perpetual differences. What's the two words that would be the extremes?
Was it solvable problems and unsolvable problems?
Yes, exactly. Thank you. Solvable and unsolvable. So 10, the theoretical therapy approach that encompasses the context of a couple is called what? Circular approach, systems approach, sex therapy approach, or ethical approach? And this is what therapists are using, this approach. Do you all remember that one? It's going to be the systems approach, yes. So 11, which of the following is true about social capital? Is it the status of being in a relationship that makes us happier? Is it the status of being in a relationship makes us healthier? Is it the experience by men and women? It is experienced by men and women differently, or all of the above. Social capital. So we're going to say all of the above. Okay, because it makes you happier, it makes you healthier, and men and women experience it, but it's a little different. Okay, 12, the triangular theory of love. Is it passion, commitment, love, persistent commitment, love, passion, intimacy, commitment, or persistence, intimacy, commitment?
Passion, intimacy, commitment.
Yes. Okay, what are the three primary contexts of communication? Is it social context, relational context, familial context? Is it cultural context, social context, psychological context? Is it cultural context, sexual context, psychological context? Is it social context, psychological context, relational context? Anybody dare?
The first one?
So it'll be the cultural, social, psychological. Okay.
Social.
All right. 14, which of the following are signs of an abusive relationship? Is it an individual who is excessively jealous and controlling? Is it an individual who pushes for quick involvement and has unrealistic expectations of their partner? Is it an individual who verbally abuses and isolates their partner? Or all of the above are signs of an abusive relationship?
All the above.
Yes. So which of the following were provided as good suggestions for dealing with a hurtful breakup? Was it rather than mourning the previous relationship, quickly jump into a new one? Was it avoid using drugs and alcohol during the breakup period because they can facilitate avoidance of grief? Would it be to make a big change in your life, like changing jobs or moving to get away from your partner or ex? Or would it be to contact your partner frequently to facilitate closure?
The first one.
Yes, let's not do the last one, right? So let's say, well, I know one is really, they want to make sure that you're going to avoid using drugs and alcohol during the breakup period, because it is one of the main ways that people will try to mask the hurt. And then it goes into other underlying issues. So even though it had rather than mourning the previous relationship, quickly jump into a new one. They don't recommend that you jump into a new one. Give yourself time to heal. So avoid using drugs and alcohol during the breakup period because they can facilitate avoidance of grief. Let's submit that. Uh-oh, it says I didn't answer one of these. What do I have?
5. If we said it's an unconditional validation.
Okay. So I guess I just
I'm
never
sorry about that,
selected.
y'all. I
It's
forgot
all
I
right.
was at work.
We
At
like you
1:40.
being at work. It's okay. Hold on. All right. So you see we got true for everything. I hope you all will go back on. Go ahead and do your, we got one incorrect. We picked 7. I think I just selected the wrong one. Let me see. All right. So affection is to be loved unconditionally. And I don't know if that was you, Sharon, that had the right one. I don't know if this was it, but 7 should be the third option. To be loved unconditionally all of the time. And like most of the time, love is uniquely experienced by each person and is both physical and emotional. Let me make sure I mark this. All right. So okay, let's keep going. We had 7, 8 is correct, 9 correct, 10, 11, 12, 13, 14, 15. So you see, if you get one wrong, you get a 93%. You want to make sure that your scores stay 80% and above. And since we're sharing the answers, just do the video so that you're not getting low scores and needing to retake it. All right, let's go to 10. So we're going to go to sexual and reproductive health. Sexual health care. So routine physical exams are an important part of the healthcare maintenance. So generally, these should occur for healthy people once every 1 or 2 years. It is generally recommended that women have gynecological exams once each year or as recommended by the healthcare provider. Now, during a gynecological exam, sometimes called a pelvic exam, a woman's health care provider typically examines both her internal reproductive parts, her vagina and cervix, as well as her vulva, her external genitals. A pap smear, which tests for cervical changes, including those related to cervical cancer and or HPV tests, may be performed as well. It is also common for healthcare providers to screen the younger than age 25 women for chlamydia or gonorrhea during the gynecological exams. However, as test practices vary, women who have been sexually active regardless of their age should ask their healthcare provider about getting tested for sexually transmissible infection or STIs. Okay. Genital self-exams. Now, they are also an important part of the reproductive and sexual health, about once each month or as directed by a healthcare provider. Now, women should look at their genitals using a mirror, and women can look at the various parts of the vulva for changes in color or texture or other irregularities. Now, once a woman knows what is normal for her body, she can detect changes and consult a healthcare practitioner if changes are found. So it's really, really important to know what your organs look like. How do your breasts feel? Massage them, work them around. What does your vulva look like? You better get a mirror, go in the bathroom, get acquainted. You should know yourself better than anybody else's body, right? Likewise, some, but not all, healthcare providers recommend that women perform monthly breast self-exams. This is done by rubbing each breast using circular motions and starting at the nipples and areola and moving outward on each breast. If any lumps or irregularities are found, a woman should seek medical treatment. And then they recommend that you get your mammograms as recommended. Usually there's 1 or 2 every year, beginning at the age of 40. So depending also on your family history, your tests may be required to be done sooner than the age of 40. So you just want to go by your physician's recommended time frame. Also, for women obtaining a regular pap test, there's an important part of health preventative care. All women, including those who are postmenopausal, should get a routine screening for cervical cancer within 3 years of becoming sexually active or by age 21, whichever comes first. During the test, cells are scraped from the cervix and examined in a laboratory. Pap tests are not painful and may be recommended annually, every 6 months or every 2 years, or other frequencies depending on a woman's personal health status. So also personal preventive health exams. Men should do monthly testicular self-examination, and those exams are done by rubbing the scrotum with one's finger to feel for lumps, bumps, or irregularities. So early detection is key, and unusual bumps should be checked by a doctor. So cancer of the prostate is also among those that occur most frequently and are mostly deadly for men, according to the American Cancer Society. So a physical examination can help detect prostate cancer early using digital rectal examination. So a digital rectal examination involves a healthcare provider inserting his finger into a man's rectum and feeling the size and texture of a man's prostate. Although some men may feel uncomfortable having this examination, it is quite common and it is an important early detection tool. A blood test is also available for early diagnosis of prostate cancer. Pregnancy and family planning. Deciding whether or not to have a child is a life-altering choice, and the birth of a child is considered by many parents to be the happiest event of their lives. So heterosexual couples may marry often, experience a great deal of encouragement and curiosity around their family planning decisions. There can be social and familial pressure on couples to parent. It is wise to be deliberate and thoughtful when taking on such an important responsibility as pregnancy and parenting. So concerns about pregnancy or fertility begin with the onset of puberty or menarche, the first menstrual period, okay? Spermionarchy, which is your first ejaculation in men. For women, menopause marks the end of fertility and it's experienced usually around the age of 45 to 55 years of age. Most women experience about 35 to 40 years of their life as fertile. It's a long time having a cycle. Men can continue to produce sperm throughout their life. As men age, the sperm do become less viable, which may contribute to a higher rate of birth defects among older fathers. However, it is possible for a man to be fertile until a very old age. Wow. We get a fertility cutoff, and they can go on and on and on. So a pregnancy happens when a single sperm penetrates and fertilizes a single ovum. Given a single ejaculation could contain up to 400,000 sperm, and a woman may have 400 or more fertility cycles during her lifetime. It is surprising pregnancy doesn't happen more often. The ova is capable of being fertilized for only 12 to 18 hours once released, and the sperm can survive in the female reproductive tract for 2 to 4 days. For this reason, when pregnancy is desired, having sperm already waiting near the fallopian tubes and uterus when ovulation occurs is very helpful. I love this picture. So in preparation for possible implantation of a fertilized egg, a woman releases hormones that promote the growth of endometrium, which is the inner lining of the uterus, and after her period each month. Later in the cycle, hormones cause ovulation to happen, and if the egg is not fertilized, the endometrial lining sloughs off, and menstruation begins again approximately 14 days after ovulation. Now the sperm and ova usually unite in the fallopian tubes. If fertilization does not occur, the fertilization egg travels into the uterus where it may attach to the endometrium, called implantation. And we know what that means, right? Following successful implantation, the placenta forms to sustain the pregnancy. The placenta that develops during pregnancy on the uterine wall contains many blood vessels and connects the fetus to the woman, providing nourishment and oxygen from the mother's body. It is connected to the fetus by the umbilical cord, which consists of one large vein and 2 arteries. So now that fertilized egg then develops rapidly and implants in the uterine wall for about 9 months for a very complex growth. This process is called gestation. So it explains the different steps and process. Gestational development is sometimes broken into 3 periods or trimesters. The first period or ovum, when fertilization, implantation, and cell differentiation happens. During the period of the embryo, 3 to 9 weeks, the central nervous system and heart begins to form, as do the gonads, ears, eyes, arms, and legs. And the 9th week until birth marks the period of the fetus. Fetal development during the remaining weeks of the first trimester includes having a human form, responding to stimulation, form vital organs, and operating circulatory system. Second trimester. During the second trimester, fetal development includes visible skeletal x-rays, forming of head, body, and hair, sucking and body movements, eyelashes, eyebrows, and translucent skin. And the third trimester includes the fetal development milestones, opening of eyes, viability to survive outside the womb, fat forming beneath the skin, and eventually, at about 38 weeks, healthy birth. Okay, so while most pregnancies are problem-free or include minor discomforts and ailments, some do involve serious medical problems for the pregnant woman or the fetus. So we do have to go over these definitions because they're on the quiz, right? I'm gonna need my water bottle. The ectopic pregnancy, if you haven't heard, is a zygote implants outside the uterus. It's often in the fallopian tubes. This can be life-threatening for a pregnant woman. An untreated chlamydia or gonorrhea can increase the likelihood of a tubal pregnancy caused by scarring in the fallopian tubes. So that's not always the case that you have chlamydia or gonorrhea, but they're saying that increases the risk of you getting it, having that happen to you, I would say. Miscarriage, which is also termed a spontaneous abortion. That means prior to 20 weeks of gestation. Rates of miscarriage vary greatly since many occur before a pregnancy is even diagnosed or detected. Preterm births, that means a delivery prior to the 37 weeks of gestation, often include medical complications for the infant, which are more serious with earlier delivery. Infants born as early as 22 weeks gestation have survived, given an amazing advancement in preterm infant care. Fetal abnormalities, sometimes referred to as birth defects. An abnormality present at birth can cause, Charlotte, can you get me some water, please? My bottle is around here somewhere. Present at birth that causes physical or mental disability. There are great variations in the severity from minor impairment to death. Tests that allow for fetal testing are the amniocentesis test, which is a long needle that is used to extract a small amount of amniotic fluid, or the chorionic villus sampling, chorionic, a sample of the placental tissue, which is extracted. Now, these tests extract cells that contain the full genetic code of the fetus. The tests do pose some medical risks to the viability of the pregnancy and are so recommended typically for pregnant women who are 30 and older and those with a family history of abnormalities. 30 and older, that is not bad. I had my last one at 41. No wonder they were stressing me out. You're high risk just because. All right. Sexuality during pregnancy. Let's get to the main points because we're not going to get through this. Let me see. All right. Although there are no rules during pregnancy when it comes to sexual activity, there are some precautions that should be observed. If a woman has a history of miscarriage, she should consult with a physician before engaging in activities that may lead to orgasm. Orgasm produces powerful uterine contractions that may induce a spontaneous abortion in some women, especially during the first trimester. If a woman has vaginal bleeding, she should immediately consult with a healthcare or professional before engaging in any type of sexual activity. If sexual activity, particularly penetration, elicits a pain response that is not easily remedied by changing position, the couple should refrain from engaging in intercourse. Particularly during the final months of pregnancy, pressure on the abdomen should be avoided. Late in the pregnancy, an orgasm is likely to induce uterine contractions. This is not considered harmful, but it may be wise to discuss with her practitioner. In overdue pregnancies, having an orgasm is one way to try to induce labor. So this can also be used as an aid. Oh yeah. Very common among women who have been pregnant, who get tired, they're at the end and they're willing to try anything. Sure, let's have sex, let's have orgasm, let's do something. Let's bring it on. And then all of this, they definitely told you correctly that it's like a guide. You should be observed because everybody's body is different. So there's people who enjoy sexual intercourse all throughout, do all kind of positions, have fun. And then there's some that are like, that doesn't work. One, I don't want to be touched. It didn't feel good. I wasn't comfortable. So everyone's body is so different. Okay. Birth. Methods of childbirth are increasingly varied as people seek alternatives to medical approaches to this life event. Long gone are days when women separate from their partner, played and sedated and passive role in this experience. Now it is typical for the couple to be actively engaged in many or all aspects of the pregnancy and birthing process. Most typical in OBGYN, a trained midwife or a nurse midwife will assist with the labor and delivery process. Births are occurring at hospitals, birthing centers, and in homes. So research conducted by Smook in 2001 examined women's experiences of care in obstetricians and hospital birth and midwives out of hospital birth centers. 4 to 9 months after the birth of their babies, Smook found that women who used midwives had more satisfying experiences than women who used obstetricians. So the decision-making process were more complex in midwifery group, and there was an opportunity to develop a relationship with the caregiver. Unlike in the obstetrician group, regardless of the type of birthing plan used, there is also a choice of whether pain medications will be used. Well, that was interesting research. Now I have a personal experience I could share, but this was good that they have some data on there. Sedatives, those are pain medications that are of choice when you do the birthing with the midwife. Sedatives, the local anesthesia, the regional anesthetic, or epidural. Now, a C-section or cesarean is a major surgery that involves removing the fetus from the uterus through an incision in the mother's abdomen. So 7 layers of skin, muscle, and organ lining are cut in this procedure. Labor and delivery complications, as well as pregnant women having some STIs, are reasons a C-section may occur. Vaginal birth is often possible for a woman who has already had a cesarean birth. That's true. And sometimes they don't encourage you to, but you can have a vaginal birth even if you've had a cesarean first. Postpartum can be a difficult time for women and their partners for many reasons. For her, these can include hormone changes, stress, sleeplessness, life changes, and depression. So postpartum depression is a severe depression that starts within 4 weeks of delivery. Research indicates that 13% of postpartum women experience depressive symptoms. Okay. All right, we got fertility, preventing sex, birth control, abortion, and problems that impact sexual function. 2, 3, 4. Okay. So with fertility, many people spend their teen and young adult years of their life trying to prevent pregnancy. It can be a big shift to focus on fertility with the intent to become pregnant. Unfortunately, some find that the untreated STIs or other health conditions may cause complications for their ability to conceive a viable pregnancy. So couples who are unsuccessful at conceiving after 12 consecutive months of trying might consider medical exams for establishing the fertility level of each person. So there are numerous causes of infertility, and they include weight, either extreme or underweight or overweight, tobacco, alcohol, or drug abuse, problems with uterus or endometrial scarring and uterine fibroids, problems with the fallopian tubes, scarring or blockage from adhesions due to prior infection, problems with the fallopian tubes, scarring and blockage from adhesive due to prior infections and endometriosis, sperm problems, not enough or poor quality, cervical mucus factors, and a problem with the ovary that cause ovulatory dysfunction. So the most common treatments for infertility include intrauterine insemination or artificial insemination. Sperm cells are injected into the uterus, and then in vitro fertilization, there's an extracted ovum is fertilized with a sperm in a shallow lab dish and placed in her uterus through the cervix. So additional procedures transfer the sperm and ova into the fallopian tubes for conception or inject a sperm into the harvested ovum. It is possible, to preserve embryos through freezing or cryopreservation for later use. So when it comes to preventing pregnancy, unprotected vaginal intercourse poses a risk for pregnancy and potential infection. And in fact, up to 9 to 10 women who have vaginal intercourse with no protection without using any form of birth control over the course of the year could experience pregnancy. Let's see, hold on, ladies. All right, sorry about that. So in discussing effectiveness of contraception, there is always a range between a perfect theoretical use rate and a typical use rate of effectiveness. The typical use rate is as much as 15% lower than what is theoretically possible with perfect to use every time. This is because human error is bound to occur since we are not perfect, and every time we do something, whether it is how we use a method or when we use it or if we use it, may variables can impact contraceptive methods' effectiveness. Among the things that can cause most influence is how well someone uses contraception, is how well the method she uses works for her and our partner. So no method is right for everyone or every one couple. Communication about the options that are available and advantages and disadvantages of each can help identify which will be best suited. Some couples choose to visit the healthcare provider together to explore this important area of reproductive and sexual health. So when we use a method of contraception, abstinence involves abstaining from vaginal intercourse. So when abstinence from anal and oral intercourse is also included, abstinence can be an effective method for preventing most sexually transmitted diseases. The withdrawal method, that involves interrupting vaginal intercourse by withdrawing the penis prior to ejaculation. And that can be a moderately effective method of birth control in the male, and it can predict a controlled ejaculation. The typical use rate for this method is 35 to 70%, and perfect use is 80%. This method provides no protection against STIs and requires a great deal of ejaculatory control, which many young men in particular have not yet developed. I like how they said that. Sorry. Fertility awareness or rhythm. So you got the withdrawal, or some people call it the pull-out method. Fertility awareness or rhythm. The rhythm method involves avoiding vaginal intercourse during certain periods during the menstrual cycle. For some women, the timing of ovulation is not as regular and predictable as once thought. So the potential for ovulation occurring more than one time during a cycle and at less predictable intervals complicates this method's effectiveness. This method is more effective if used consistently and correctly while combining the use of one of the following techniques. The calendar method, the basal temperature method. This predicts fertility by measuring a woman's internal body's temperature. The cervical mucus method, and then you have spermicides. Oh, the first, those three methods, the calendar, the basal, and the cervical, were the ways that people do the rhythm. Okay, they calculate fertility based on those three methods. Then you have spermicides, that are substances that kill sperm. Spermicides are available over the counter at most drug grocery stores and in a variety of forms, including gels, foams, creams, films, and suppositories. Now, spermicides can be up to 85% effective, but can cause irritation or allergic reaction for some, and thus increase one's susceptibility to STIs. Then you have the diaphragm, which is a latex silicone disc that is placed inside the vagina that provides a barrier to the cervix. And when used consistently with the spermicidal gel, it can be 94% effective. I don't even know if they're using diaphragms now. I think those are a little bit outdated, but okay. With correct and consistent use, the condom can provide excellent protection against both pregnancy and STIs. Condoms are available over the counter at a variety of locations. Animal skin condoms do not provide protection against STIs, while latex polyurethane condoms do. So female condoms are made from polyurethane, and effectiveness for typical use is 79%, and for perfect use is 95%. All condoms should be used only one time and disposed of. Using condoms correctly and consistently is important. Okay, so some of the reported errors include 74% failed to check the condom for visible damage, 61% did not check the expiration date, 60% did not discuss condom use with a partner, 43% put a condom on after starting sex, and 15% removed it before sex was over. Wow, 42% reported they wanted to use condoms, but none were available. 40% did not leave a space at the tip. 35% reported slippage or breakage during sex, and 30% placed the condom on upside down and flipped it over. So those were some of the reported errors according to the 2002 report. So combining latex condoms with hormonal and other contraceptive methods like IUD can provide double protection from both pregnancy and STIs. Birth control and abortion. Birth control pills and oral contraceptives are most commonly used form of contraceptive. Pill users may take a pill daily during 3 to 4 weeks. 3 weeks of each of the 4-week cycles. Oral contraceptives prevent pregnancy through the use of hormones. So you have the contraceptive patch, which provides continuous protection against pregnancy for 1 week. This patch is nearly 99% effective at pregnancy prevention if used correctly. The vaginal ring or the Nuva ring provides a month-long protection through a slow release of hormones from flexible ring inserted in the vagina for 3 weeks. Then there's hormone injections, and they can provide continuous protection against pregnancy for 1 month or 3 months. And that's the Depo-Provera. Then there's the intrauterine contraceptive, or the IUC, or the IUD. One is Mirena, provides continuous protection against pregnancy for 5 years, or the other, Paragard, provides 10 years of protection. Drink a little more water, hold on. Emergency contraception, EC, can be used up to 120 hours after unprotected intercourse. EC is not an abortifacient or a substance that causes an abortion. Rather, it is a form of birth control that prevents pregnancy from occurring. It is available from a pharmacy without a prescription for women age 18 or older. EC is most effectively if taken within 24 hours. When it is up to 95% effective, when it is used at 72 hours or later, effectiveness drops. EC provides no protection from STIs. Then you have surgical non-hormonal methods like tubal ligation, which is a surgical procedure where the fallopian tubes are cut and each end closed. Once closed, ova and sperm can no longer travel through the tubes to unite. Then there's the vasectomy, which is a surgical procedure where the vas deferens is severed at each end and sealed to prevent sperm from traveling through and being released from his body. Both are highly effective. So typical use, 99.5% for female and 99.9% for male. Perfect use, 99.5 for female and 99.9 for male. And neither procedure should be considered reversible, since success at reversal is low, although successful reversal is more common with vasectomy than tubal ligation. No STI protection is provided by either surgery. I'll raise my hand and care to differ. I got a mom who got a tubal ligation reversal and had another 3 children. So abortion, there are two kinds: spontaneous abortion, also called a miscarriage, and it is a natural or unintended interruption and cessation of a pregnancy. It is thought that approximately 10% of all known pregnancies end in an unplanned spontaneous abortion or miscarriage. Of course, many more occur without being known or reported, and since it may happen before the detection of the pregnancy. Then there's induced abortion. So as a medical termination of pregnancy, nearly all medical abortions occur before the 12th week of gestation, and induced abortions can be done through surgery or by use of medication. All right, we're going to go on to the next section, which is the last one: problems that may impact sexual functioning. So interpersonal problems in a relationship have a direct influence on the level of satisfaction experienced sexually in the relationship. So among the most common reasons for withholding or avoiding sex with a partner is relationship troubles, feeling angry, disappointed, or sad about something in your romantic relationship that can dampen the libido. So just as intrapersonal emotional distress, like depression, can, researchers have consistently found that sexual and relationship satisfaction are intertwined for both men and women. So sometimes sexual dissatisfaction is due to not having access to information about oneself or a partner that is sufficient to learn about and experience the desired response. So cultural messages that impose unrealistic or inaccurate ideas about sexual functioning and interactions can also create barriers to sexual well-being. So our health status and that of our partners can have a big impact on sexual functioning and well-being. Chronic illnesses that impact sexuality include diabetes, cancer, multiple sclerosis, stroke, and some of the medications that treat these illnesses, as well as those that treat depression and high blood pressure, can impact sexual functioning. So typically, these drugs impact sexual functioning by interfering with sexual arousal or orgasm. For example, cancer treatments can cause vaginal dryness, vaginal pain during the intercourse, and sensitive areas in the skin caused by the radiation. So lack of libido, and difficulties reaching orgasm, or impaired body image. So many of these problems improve after treatment, and they improve after treatment, but some problems persist for months or years following the treatment. So as a sexual health promotion professional, you may have to be the first person who has asked a cancer survivor about his or her sexual well-being. You can play an important role in helping to connect them with books, such as Ann Katz's book, Women Cancer Sex, or products such as a lubricant, cream, or vibrator, or professionals such as a trained sex therapist or counselor who can assist them with their sexual lives. Aww. So we have categories of sexual dysfunctions. We have sexual desire disorder. We did talk about this in our previous chapters about that hypoactive sexual desire disorder. Sexual aversion disorder, that is aversion to avoidance of genital sexual contact with a partner, causing interpersonal difficulties. Then you have the female sexual arousal disorder, inability to attain and maintain an adequate lubrication, swelling response, or sexual excitement. Male erectile disorder, also known as ED, inability to attain and maintain an adequate erection until desired. Orgasmic disorders, female orgasmic disorder, delay or absence of female orgasm. Male orgasmic disorder, meaning delay or absence of male orgasm following sexual excitement. premature ejaculation, ejaculation with minimal sexual stimulation before desired. Then you have sexual pain disorders, dyspareunia, which is pain associated with intercourse in either a male or female, causing interpersonal difficulties. And the vaginismus, involuntary spasms of the vaginal muscles that interfere with penetration, causing interpersonal difficulties. So we're going to take a look at what activities are here. What did they give us for interactive activities? Map your community's resource. So sounds similar. It says communities vary in terms of types of organizations that support sexual and reproductive health of its residents. As a sexual health promotional professional, you will likely encounter women and men who could benefit from being connected with those in the community. So it says take the next few days or weeks to identify and contact organizations in your community that provide the following resources. Then type your responses in the text boxes, save your responses, and submit at the last page. When you have completed the assignment, once you have submitted your response, Dr. Herbenek or Dr. Reese will log in and grade your assignment so that you can proceed to the next unit. Okay. Where in your community can a pregnant person go for medical care during pregnancy? Identify at least 2 clinics or organizations that provide prenatal care in your community. List their name, address, telephone number, website, and the types of services they offer. Which clinics or organizations offer low cost or sliding scale prenatal care? If there are no clinics in your immediate community, how far would a pregnant person need to travel in order to seek prenatal care? All right. So list at least 2 resources in your area. All right. As you can see, I didn't get to that part, right? Hold on one second. I need to get to one of my screens. We're going to do the quiz real quick and run through, and I apologize, we're running late this evening, getting finished, but I think we did good progress. Chapter 10. My computer's doing something strange. Okay. I can't split my screen. All right, we're going to do 10 quiz really quick. Here we go. All right, so question 1, unit 10 quiz. Men can continue to, oh, I didn't share the screen, sorry. Yes, and I do want you all to participate. I just forgot to share the screen. Okay. All right, there we go. I'm ready now. Thank you for hanging in there. I was feeling all alone. Men can continue to produce sperm throughout their life, and women can continue to produce eggs throughout their life. True or false? We said there was a difference. Remember, men can continue to produce sperm.
That's false.
Yeah, that's false. And we got a cutoff. When menopause hit, that's it. That's the end of fertility. All right. 2, abstaining from vaginal penile sex will prevent individuals from an unintended pregnancy and from contracting any STIs. True or false?
It's false.
It's false because without real protection, STIs are prevalent. 3, correct and consistent use of the condom or the diaphragm greatly reduce the risk of contracting a STI. True or false? It's a trick one. Listen to it.
False.
Right. Because correct and consistent use of the condom would reduce some STIs, right? But a diaphragm, which is like the sponge or like that disc that women insert in there, that is only going to keep you from being pregnant. That is not going to stop a STI. You're fully exposed. Okay, so 3 is false. 4, orgasm. Orgasm could help to aid in bringing on labor in the 3rd trimester of pregnancy. True or false?
True.
Yes, who said that so loud? Somebody said, I know. No. All right. This term refers to the onset of a woman's first menstrual period. Menarche, anarchy, menopause, or dysmenorrhea.
Menarche.
Yep, menarche. All right. This term refers to an end of a woman's fertility. Y'all got this. This is easy.
Menopause.
Yes. 7, a visible skeleton on x-rays, the formation of a head and body and hair, sucking and body movements, and the development of eyelashes, eyebrows, translucent skin occur during which trimester of pregnancy?
This is the second?
Yeah. Who was that answer?
Me.
Okay. Yes, 2nd trimester. Miscarriage. All right. What is it? Is it the zygote implants outside of the uterus, in the fallopian tubes? Is it abnormality present at birth that causes physical or mental disability? Is it a spontaneous abortion? Yep, spontaneous abortion prior to 20 weeks of gestation, or did they say a delivery prior to 37 weeks? We're going to say spontaneous abortion and miscarriage are one and the same. 9, preterm birth. What is a preterm birth? We kind of read it. Is it a zygote implant outside the uterus? No, that's a tubal pregnancy, tubal. Is it an abnormality present at birth, birth defects? No, that's not preterm birth. Is it a spontaneous abortion that we just talked about? No. It is a delivery prior to 37 weeks of gestation, the last one. Okay, the ectopic pregnancy. They just told you. What is
That's
it?
the first one. The first one.
The first one, yes. A zygote implant outside of the uterus, often in the fallopian tubes, and it can be life-threatening for a pregnant woman. And we had already defined the other 3, so I'm not going to read those aloud for those who are doing the audio. It's the first one. It's also known as a tubal pregnancy, ectopic pregnancy. All right, we're at 11. Blank is a severe depression in women who have recently given birth, which starts within 4 weeks of delivery. symptoms include deep sadness, empathy, loss of interest in things previously enjoyed, and withdrawal. What is it? Is it infertility depression, postpartum depression, perimenopause depression, or anxiety depression? Which one?
Postpartum.
Postpartum.
Yes, ladies. We hear it's often about postpartum depression. Which of the following is an example of hormonal birth control method? Is it a birth control pill? Is it the NuvaRing? Is it the Depo-Provera injection, or all of the above?
All of the above.
All right, all of the above affect the hormones. And some of us have had experience with all of them, and some of us with some of them. 13, research indicates that women who use blank are likely to have more satisfying birthing experiences than women who use blank. What is it, ladies?
Midwives and obstetricians.
Yeah, so women who use midwives are likely to have more satisfying birth experiences than women who use obstetricians. And that was at-home births that they were rating it, remember, because there's midwives in the hospital now, but there was a difference. I think it's also the environmental factors. Your body responds a little bit differently in a clinical environment opposed to a more home environment. Even birthing clinics kind of set it up like you're at home. It just won't have all the other personal items in it or the junk. No. I'm being humorous tonight. Y'all laugh with me. It's okay. 14, a primary factor that plays a role in the level of sexual satisfaction of a couple is the abstinence of children. Is it infidelity? Is it interpersonal problems in a relationship, or none of the above? I am tickled.
Number 3, interpersonal problems in a relationship.
Yeah, so that's a primary factor that plays a role in the level of sexual satisfaction. We can have interpersonal problems going on. And 15, tubal ligation, vasectomy, and intrauterine device, or also known as IUD, are all considered reversible forms of birth control.
Why are you trying to turn the fan on? False.
False. They just switched it up on you, right? You had to make sure you was paying attention. All right, let's go ahead and submit. We have true for number 1. Number 1 is correct, that it is false. Number 2 is false, and that is correct. Number 3 is false, that is correct. Number 4 is true, that is correct. Number 5, menarche, and that is correct. Number 6, menopause, correct. Number 7, second trimester, correct. Number 8, a spontaneous abortion, correct. Number 9, preterm birth, a delivery prior to 37 weeks, correct. 10, ectopic pregnancy is the first one, also known as a tubal pregnancy, implants outside the uterus, that is correct. 11, postpartum depression, correct. 12, all of the above are examples of hormonal birth control, correct. 13, midwives and obstetricians, correct. 14, interpersonal problems and relationships, correct. And 15, false, and that is correct. All right, any questions, ladies?
No.
And thank you for hanging in there.
Thank you.
Thank you.
Yes, do any of you all need help? Where are you at in your course? Let me stop recording. I don't have to have that part recorded. Hold on.